Thank you very much. And it's a pleasure to be here. And thank you, Green Crescent organization, Turkish Green Crescent, for the possibility to be here in Istanbul. And the whole conference is focusing on very large political and drug policy issues. And I would like to address just a very small part of it, which is addiction treatment services for children. They are a very small part of overall interventions that have a proven efficacy. At the same time, they have a very long-term impact, since if a child becomes addicted at an early age, that addiction will probably follow him all his or her life. So I was trying to figure out what is the connection between Lithuania and Turkey, and how can we connect the idea of exchanging experience and sharing experience and learning from each other's experience when the size is so different. And I have kind of calculated that to make us feel better, that, and I didn't dare to compare with the whole Turkey population, so I just said that Istanbul population is only 6 times bigger than Lithuania as a country. At the same time, even though big is beautiful, still experiences, small experiments, smaller research can actually provide some guidance and ideas on how to do things different or better. So today I will talk about the findings of the study of the addiction services for the accessibility to the services for the children. And I would like to thank Lithuanian Drug, Tobacco and Alcohol Control Department, as well as State Mental Health Center, which provided large parts of the data. Today I will talk very briefly about consumption patterns of psychoactive substances among school children in Lithuania, a little bit about what data do we have on the treatment services provision, and the results of the accessibility study. This little bit complex graph shows you what is a problem of consumption of psychoactive substances in Lithuania. And the interesting part is that on the horizontal axis, you have the grades from the 5th to the 12th grade. So you can see that consumption is very closely related to age. The closer school children get to the being adults, they accept the norms of the society that are prevalent. So their consumption of both legal and illegal substances is increasing. And as you see from this graph, still the main problem in Lithuania, from the drug use perspective, is alcohol. And nearly 83% of boys consume alcohol, and nearly 72% of girls consume alcohol. They would answer yes to the question about the consumption. This is very high, and if you see, compared with the illegal drugs, they increase much slower, and they also reflect the harm and the consumption pattern in the adult population, which is relatively low in Lithuania. Here also just to indicate that the trend is favorable. We can see that the alcohol consumption for the past 12 months, since 2004 to 2012, has decreased somewhat, quite substantially, and the same holds for the consumption over the past 30 days. So we see that the overall consumption in the society is very prevalent, just like in adult population, but at the same time, the immediate consumption, the acute consumption, and over the year, it is going down for both boys and girls, which is quite an encouraging trend. At the same time that we see that for the boys, regular consumption, which is a relatively low proportion of school children who do consume alcohol regularly, is actually again on the increase. It's about 13% right now, and we still have the data for the further years, and it is somewhat increasing. The same trend is a decrease for the girls. Here is to show also with what we deal, because only a small proportion of children end up with a hospital or the treatment services, and you see that there are the differences in services provided for children with alcohol intoxications when they're hospitalized. It has been increasing quite dramatically, 17 times in 6 years, and then it started rapidly to decrease. I would be glad to answer some questions, because this was also about the policy. It was not only about the treatment, but this decrease is also due to policy change. This is also to see the next biggest drug that is used in Lithuania is basically tobacco. And again, we see a reduction from 2004 to 2012, as you see from this graph. This is just to show the proportion of illicit drugs used. This is the children that answered that, yes, I have used an illicit drug once or twice in lifetime. And you see that that part is actually increasing. We have a long tradition of treatment services for the children, which are covered by the state. They are covered by the state health insurance. And over the past 20 years, there has been additional developments. We have service provision in both mental hospitals, also in a specialized addiction centers with beds for children. We have outpatient facilities, and in every community, we have primary mental health centers, which also have addiction specialists among their staff. And that means that children, the parents, families, they can have a consultation immediately without prior contact with the GP. So that is on the primary level and easily accessible services. So I hope I have convinced you that we have a consumption problem in Lithuania, especially alcohol, somewhat of drugs. There are quite a number, about 10–13% of school children that are regular users of alcohol, and at the same time, services provided according to the Lithuanian health insurance data, they are negligible. This is not per 100,000. This is the actual absolute numbers of the service provision due to use of psychoactive substances and use of alcohol separately as well. So we see that the services provided to school children, they are basically non-existent. They are increasing somewhat, but 13 cases of treatment for alcohol use is very, very low. So we have looked at it in more detail, but still, even for cannabis use, even when we look at the different substances, these are all by ICD-10 classification, still you see it's a little bit irrelevant because nearly no cases of treatment for cocaine and a couple for heroin, but no for tobacco, have been during 2008-2012 period. So here we have some little bit higher numbers for alcohol intoxication, which is coded differently. But still, as you see, the numbers are relatively small and decreasing. So the reason why we have made this assessment study for the accessibility, the idea was that the consumption is high, but service provision is very low. We did estimate that there should be a much higher number of children who would need the services due to highly prevalent consumption in the society. And yet it was not there. So we have designed a small study which covered nearly all of the cases that have received treatment services in Lithuania for the past couple of years. And we have designed a very practical survey that had 3 parts, and they were matching surveys for both a parent or a carer, a child, and a specialist who provided the service. So we could have matching answers to see basically if the understanding of accessibility of services is the same in all the stakeholder groups as well, like a child, a parent, and a specialist. So here you see a little bit, we have surveyed 46 children who received addiction services, also 46 parents or carers. It's interesting that half of the cases were from the so-called child care homes, basically orphanages. So it also suddenly drawn our attention to that part, that even in the state children's homes, the prevalence of alcohol abuse and also drug problems were quite prevalent. One of them, I will go through some of the results just to have an idea, because as I said, this was the goal of this study was to really assess practically and to see how we can improve it. We have services historically for very long, and they are used. It's just that how to improve access to them and their results. So one of the interesting findings was that the reasons for contacting addiction services was quite clear-cut. Both parents and children, they did understand that the only reason they're coming to the mental health center or they're coming to addiction center is because they are using a drug. Because we thought that one of the access problems could be that they're mistakenly coming for, they're being sent because of the behavioral problems, because of school problems, maybe because of a mental disorder that is not diagnosed. At the same time, the specialists have drawn our attention very clearly that they do not see any children who come by themselves, that the main gateway is always a parent or a caretaker. So we always have to focus on that. So this was an interesting finding from the point of view, because even in our prevention or promotion policies, we quite rarely target parents because they are quite a difficult group to reach. Here is some information about the substances due to which the children had to get those services. And just as in the epidemiological data, it clearly reflects the pattern of consumption of drugs in the society. The main problem is alcohol and tobacco, and at the same time, out of illegal drugs is cannabis. What is also interesting that according to ESPAD study, Lithuania has quite high numbers of the adolescent use of anxiolytics and sedatives. Our government is still debating the data, by the way. We're trying to figure out why, because we're a little bit different from Poland. But this study also has shown that, yes, there is a significant proportion of children who do accept, and their parents, that they are using. But that does not show on the official statistics of the service provision. So another interesting finding was that even though the services that are provided and registered by the health insurance and paid for, actually there are more services provided, not in a clandestine way. These are regular service conditions. The problem is that they are not properly statistically filed. Regarding accessibility, our main and most interesting finding was that even though it takes a very long time to contact the service, we see that average was about 18 weeks since the person who is responsible for a child understands that there is a problem to the contact that is actually made. While after the contact is made, the service access is within 1 week. And there was a good agreement among children and parents that within 1 week from the contact, they have actually received the service. Another important finding that we found, and that will be also have included into our recommendations, is that we need to improve referral services, because what was shown by this study is that nearly none of the groups, such as school, such as GP, such as social services, have actually referred those children. Most of the children came either by the parents or the responsible adult, a carer from the care institution. So we do need a much more involvement of the GPs, of the schools, and of the systems that have been designed, at least theoretically, designed to take care of the health and welfare of the children. And also, just to give an example of the small outcome that we did not intend to have, is that what it has shown as well, that according to the both children, carers, and specialists, we see very high effectiveness of the interventions provided. So we see that basically 33% have concluded that the problem has been solved. They're not using alcohol or drugs anymore. And actually, more children have claimed that they have stopped using as an outcome of the intervention. And as we see, the accessibility satisfaction and accessibility ratings were so high that they were a little bit irrelevant. So we were more interested in the time from contact to actual delivery of the service, and we found that very acceptable. We see that different aspects of the service characteristics, they were also received very favorably, even though there was a little bit lower assessment for the effectiveness of the service in the other. So here I come to the conclusions, and our main ones is that we do need to improve referral system, especially work and train with the GPs and school teachers, and to reduce the stigma, because it seems that people who understand the problem, they're deliberating too long, because if we could cut this time between when I see my child having a problem and actually calling somebody, that would, at least in Lithuania, could cut the access to the service quite dramatically. So we have concluded that the services themselves are quite accessible, they are quite effective, and we're working hard now on publicizing this data and also working with the ways to reduce stigma and to address this referral problem. Just one more thing to remind, that this is just a very small part of any policy. Treatment services for the children is very small, but it does contribute to this a little bit complex graph, which shows alcoholic psychosis incidence. And these, all these references are to the major policy initiatives that were taken in Lithuania. And you see how it really cuts into psychosis numbers. If you have the correct policy, it really goes down fast. If you have the wrong policy that promotes alcohol consumption, you have dramatic increase. So we need all bits and parts to be coordinated to have a policy impact in what we do. Thank you.